Let's move on to the third section, and in this section we will talk about the very common procedure known as submucous resection, SMR, of the nasal septum. While talking SMR, about the SMR submucosal resection, we will discuss the indications and contraindications of this procedure. Also, anesthesia use, position, and steps of the operation, post-operative care, complications, and present status of SMR. Indications for submucosal resection, we have DNS, deviated nasal septum, very important or common indication, and deviated nasal septum itself is a common condition. The septum is the partition between the two sides of the nasal cavities. It separates the right and left nasal cavity, and the deviation of the septum, if it's not in the straight line or if it's deviated to one or the other side, usually it's troublesome or cause problem, especially when it cause obstruction or nasal obstruction. So that needs to be fixed if that is present, DNS, deviated nasal septum, and the procedure that is used to correct that septum in the DNS is SMR or submucosal resection. DNS causing obstruction to ventilation of paranasal sinuses and middle ear. Recurrent epistaxis from septal spur, that's another indication. Lot of people, if there is septal spur or there is a spurring of the septum, that can cause epistaxis or constant nosebleed. That's also an indication for SMR. As a part of septorhinoplasty for cosmetic correction. So for cosmetic reason also, if there is septorhinoplasty, repair of the septum and nasal cavity, we can also do this procedure. As a preliminary step in hypophysectomy or Vedian neurectomy. The contraindications of SMR or submucosal resection, patient below 17 years as with anterior antrostomy, that's also a contraindication. So SMR should not be performed in patients who are under 17 years of age. Also acute episodes of respiratory infection. Bleeding diathesis, there will be increased bleeding in patients who have bleeding disorders, so it should not be performed. Untreated diabetes or hypertension is another contraindication. Anesthesia and position of the SMR or submucosal resection. Anesthesia used can be local, which is preferred. So we can use local anesthesia or the general anesthesia, but it's a simple procedure, not a complicated procedure. As with other procedures also, we can use both the local and general anesthesia, but local anesthesia is usually preferred. In children who are not cooperative, we can use the general anesthesia, and in adults who are apprehensive and anxious. Position of the patient, reclining position with head end of the table raised. So that's the position, reclining position, and the head end is raised. The steps of the operation: infiltration of the nasal septum in subpericondrial planes with 2% xylocaine and 1:50,000 adrenaline. So that's the use of infiltration of the nasal septum. For local anesthesia, xylocaine is used along with adrenaline. Incision, what type of incision is used? A curvilinear incision with forward convexity at mucocutaneous junction on left side of the septum. Cuts only through mucosa and perichondrium. So these are the incisions which are used for the submucosal resection. A curvilinear incision with forward convexity at mucocutaneous junction on left side of the septum. Elevation of mucoperichondrial and periosteal flap. Perichondrial, which is around the cartilage. Chondria is for the cartilage, ostia is for the bone. So elevation of after the incision or the cut, the mucoperichondrial or periosteal flaps are elevated. Plane of dissection is beneath the perichondrium and periosteum. Incision of the cartilage incise just posterior to first incision. Avoid cutting opposite the mucoperichondrium. Elevation of opposite mucoperichondrium and periosteum with elevator pass through cartilage incision. Mucoperichondrial and periosteal flap raised from opposite side of the septum. So incision is given, then mucoperiosteal flaps are elevated with elevator pass through the incision. Removal of cartilage and bone. Cartilage removed with Ballinger's swivel knife. So after the flaps are removed and we can see the deviated part of the septum, that portion or the cartilage is removed with the Ballinger's swivel knife. Bone with the Lux forceps. Bony spur or ridge removed with gouge and hammer. So here you can see any spur, any deviation needs to be removed, and then the proper alignment of the septum is done. Stitching. 1 or 2 catgut or silk stitches are used in initial mucoperichondrial incision. Packing, ribbon gauze smeared with antibiotic ointment or liquid paraffin, packed in each nasal cavity, nasal dressing applied. So after the bone and cartilage is removed, then we do the stitching, and then packing should be performed, and then nasal dressing is applied. Here you can see the stitching. Post-operative care, semi-sitting position. Here, that's the semi-sitting position. A soft diet in the 2 post-operative days. Analgesics should be used. Antibiotics for 5 to 6 days. Nasal packs removed after 24 hours. Decongestant nasal drops and steam inhalation for 5 to 6 days are used. Silk stitch removed on 5th or 6th day. Avoid any trauma that is present. So all these are the steps that should be adopted after the procedure to avoid the complications. Complications that can occur, bleeding is sometimes present. Septal hematoma, as a result of bleeding, hematoma is formed and there is swelling. Septal abscess can develop also if there is infection. Perforation of the septum can also develop. Depression of the bridge, because the septum is the area which is operated on. If there are complications, then the depression of the bridge can occur. Retraction of columella can also occur. Persistence of deviation even after the removal, the septum deviation cannot be corrected completely and it can persist. Flapping of the nasal septum. Toxic shock syndrome. So, a lot of complications are associated with the submucosal resection. Common procedure performed on the nasal septum. Nasal septum is the partition between the two nasal cavities, and the perichondrial and periosteal flaps are elevated after the incision. The cartilage and bone is removed, stitches are performed, packing is done, and then also we have so many complications including bleeding, hematoma, abscess, persistence of deviation, retraction of columella, and toxic shock syndrome. Present status is replaced by septoplasty. Now, instead of submucosal resection, septoplasty is commonly performed. So, it is replaced by septoplasty, which is the repair of the septum. Here, the deviated part is removed and the reshaping is performed. Only indication is when cartilage or bone from septum is required for a graft. So that was all about section 3. Thank you for watching sqadia.com.